guess the best way to describe my role in patient care for patients who come to sick kids for treatment is to kind of walk you through what would happen on a particular day. So if a patient with a liver transplant, say, comes in to sick kids to get a checkup, my role would be to look at the blood tests to make sure that that graft is functioning, to look at the microbiological tests to rule out any infections, and to look at the biopsy under the microscope. And by looking at the biopsy under the microscope, I can exclude rejection, I can exclude infection in the graft, and I can also look for other signs of graft dysfunction. And with all that information, we're able to communicate that to the treating team, and they're then able to treat the patient according to those results. And that results in the best functioning graft possible and the healthiest child possible.
Patient care is actually central to what we do in HemePath. From the moment the patient walks into the hospital, they're getting blood work drawn, it's coming to the lab, we're reviewing the results, we're involved in communicating with their doctors in the emergency room or on oncology floors. And we also make really important diagnoses, a lot of cancer diagnoses, and this is central to how the patient's going to get treated, and everything that happens downstream of that diagnosis impacts that patient. So patient care is really central to the role of the laboratory physician.
I know that pathologists are usually behind the scene, but they are needed to make a bridge between science and medicine, and this is amazing about pathology.
I think there's two things that laboratory physicians get to do that not many other physicians get to do. One of them is we get to interact with all the physician groups across the hospital. A lot of the children that come into sick kids, the clinical decisions that are made are based on the tests that we do. So we get called to speak to lots of physician groups and guide them so that they know how best to treat their patients. And I think the second thing that we do really well is communicate. It's ironic because there's a misconception that laboratory physicians are not really good communicators, but I think the opposite's true. We communicate really well, and we have to. We have to synthesize a lot of data into usable information for the physicians to be able to then treat their patients. And we have to do that often in times of urgency or in stressful situations. For example, during an intraoperative procedure, we have to communicate with the surgeon what we think the disease is and make a collective decision on how best to manage that in the moment.
We do a lot of communicating with other physicians, often calling emergency room doctors and other physicians around the hospital. We're interacting with technologists. We may be involved in making decisions about how the lab runs or what equipment we're getting. It's a little bit of a different role in that we're not right at the bedside, but we do make a lot of decisions that impact patient care.
I love the teamwork from the beginning to the end, from receiving a specimen until I push the bottom of sign out.
I just find it's visually stimulating. I'm looking down the microscope, the cells are interesting. So it's actually kind of a fun job in that I'm always looking at something different, and it can be puzzling and fascinating. The other thing I love about my job is teaching other people. So I have a lot of residents and medical students that come and work with me, and I really enjoy seeing their fascination when they see something new and interesting.
The thing I love about my job is I get to interact with lots of different people, not just physicians, but scientists, nurses, ancillary healthcare staff, and sometimes patients. It's incredibly rewarding. Overall, contributing to healthier children across the globe is very satisfying.